Hello, my name is Heidi Ibertowski and I am the Certified Wound Ostomy Nurse for Valley Memorial Homes. And today we are going to be going over skin prevention. Just some quick facts about skin and wound care. Skin is the largest organ in the body and it makes up about 16% of the body's weight. It contains 3 layers, the epidermis, dermis, and the subcutaneous layer. A mechanical injury develops from friction and shearing forces. This is a picture of the layers of our skin. As you can see, the top layer is our epidermis, the next layer underneath is our dermis, and then below that is the hypodermis, which is also called the subcutaneous layer. The epidermis provides a waterproof barrier and creates our skin tone. It helps protect us from the environment and organisms and bacteria from entering into our bodies. The dermis contains tough connective tissues, hair follicles, and sweat glands. The subcutaneous layer consists of fat and connective tissue. Pressure injuries are a result of prolonged pressure in combination with shear and usually over a bony prominence. Friction, shear, moisture, pressure, and trauma are all frequent causes of skin breakdown. Pay particular attention to changes in skin color, temperature, texture, moisture, and any lesions present. Report all changes to your charge nurse. We are now going to be going over C.N.A care guidelines. First topic, skin care. Cleanse the skin with warm water and Aloe Vista number 1. Moisturize the skin with your morning and evening cares. Use Aloe Vista number 3 if the resident has very dry skin. Do not massage over any bony prominences as this can cause further tissue damage. Use draw sheets or Swift sheets for boosting residents up in bed to prevent shearing. Look at your Cardex to see what is care planned. Keep linens dry, clean, and free of wrinkles. Turn and reposition residents every 2 to 3 hours. This is critically important to prevent pressure injuries, and this is our standard of care. Peri-cares are to be completed with morning and evening cares. All residents who are incontinent should have a barrier cream applied with peri-cares in the morning and evening and after each incontinent episode. This slide demonstrates different pressure points on the body in different lying positions. Pay particular attention to the sacrum and the heels, as these are the most common areas of pressure injury development. This slide demonstrates different pressure point areas when someone is sitting up in a wheelchair. They are at risk at their scapulas, elbow areas, sacrum, ischium, ball of foot, and their heels. Pay particular attention to their positioning when they are up in their wheelchair. What to report? You need to report any abnormal skin findings to the nurse as soon as you notice it. It is very important that they have an assessment as soon as possible by the licensed nurse. This includes all reddened areas, bruises, abrasions, skin tears, blisters, and rashes. Make sure someone comes and assesses it as soon as they can. It is very important to document and get things put into place as soon as possible to prevent further skin breakdown. These are just a few examples of things that if you've seen when you were providing cares with the resident that you would want to make sure that you would go grab a licensed nurse to assess further. Some of you may have not seen pressure injuries before, but here are a few examples of what pressure injuries look like. Starting with stage 1 up in the far left corner, progressing to a stage 2 where the skin is open. Stage 3 is through the first 2 layers of the skin into the subcutaneous layer, and stage 4 is through all layers of the skin, usually through the bone. Unstageable means that the resident's wound bed has some eschars left on it, basically covering the wound bed that we can't visualize what's underneath it. And a deep tissue injury is a pressure injury that looks like a dark, deep purple bruise. It is important to report any accidental bumps that a resident gets right away. It is good to know in case a bruise develops later. If it's documented in the resident's record, for instance, she bumped her arm going through the doorway, and a bruise develops later, it eliminates the need to do an abuse and neglect investigation. Moisture-associated skin damage, also known as MASD, can result from prolonged exposure to moisture that can occur anywhere on the skin. The slides show different types of MASD caused from whether it's urinary or bowel incontinence, or residents that are obese and get moisture trapped in their skin folds, especially in their abdomen and under their armpits. These are examples of MASD. So what happens when the skin is exposed to excessive amounts of moisture? It softens the skin, causes it to swell, and appears wrinkly, making it more susceptible to friction and damage. Residents that are incontinent of bowel and bladder are 22 times more likely to develop pressure injury. Residents should be toileted every 2 to 3 hours and as needed, if able, or on a check and change program 2 to 3 times a shift and as needed. Make sure the skin is cleaned well with wipes or cleansing foam or soap and water when you're doing peri-cares after each incontinent episode. Then it is very important to apply a barrier ointment to protect the skin from incontinence. Report any loose stools to the charge nurse as soon as possible. We use C.N.A products for our incontinent management. We have pads, adult protective undergarments, also known as pull-ups, and briefs. Make sure the resident is in the correct product and correct size. If you have any concerns or questions regarding what product a resident is in, please utilize your C.N.A manager on your neighborhood. For our skincare products, we use Convatect, and those are all the Aloe Vista line. Again, it is very important that each resident is assessed for correct product to manage their incontinence. Every neighborhood has a C.N.A manager. Please work with the C.N.A manager to ensure correct size and product is being used to manage the resident's incontinence. This slide demonstrates all the different products available from Convatect with their Aloe Vista skincare line. Make sure you stock the resident's room on admit with the products they will be needing. Make sure not to overstock, however, as that is wasteful and we end up throwing product away. It is important to moisturize dry skin at least twice a day to promote healthy skin. Lotion should be applied in the morning and evening with cares, and after bathing and showering to help lock in moisture. There is a fine line between excessive moisture and dryness. Although moisture on the skin does not directly cause pressure injuries, it softens or macerates the skin, making it more susceptible to damage from friction and shearing. So we don't want the skin to be too moist. However, dryness, on the other hand, is when the skin loses its moisture and it becomes very dry, flaky, and less flexible. Pressure injuries are more likely to develop in dry skin. C.N.A wipes should be stocked in all residents' rooms who are incontinent of bowel and or bladder. C.N.A wipes gently cleanse and moisturize fragile skin with an extra soft, cloth-like quality texture for residents' comfort. Be sure, however, to not flush these down the toilet as they are not flushable wipes. Another product that can be used for incontinence care management is the cleansing foam. It is a gentle no-rinse cleanser and it is made to be used anywhere in the body. It can be used in the hair and in the perineal area. Another option is the cleansing cream. The cleansing cream is an all-over body, hair, and perineum care. Cleansing cream becomes a no-rinse when it is placed in a basin of water, so you can also use this as an option with your AMHS cares and with your incontinence cares. Aloe Vista number 2 is a daily moisturizer. It is a long-lasting formula that helps protect and prevent chafed, chapped, and cracked skin. Use this with AM&HS cares and also after bathing to help lock in moisture. This helps prevent dry skin and also, like I said in the earlier slides, will help protect against pressure injury development. Aloe Vista number 3 is our protective ointment. Protective ointment is a petroleum-based product that contains emollients to moisturize. It is easy to apply and is non-sensitizing and fragrance-free. This is the ointment that should be applied after each incontinent episode and at minimum with AM and HS cares. Also, this is great on legs as well if someone has really dry, cracked skin, or if they have venous stasis ulcers and they have a lot of moisture that is draining on their skin around their peri-wound. This makes a great barrier for that as well. As I said in one of the earlier slides, the heels are the number 2 area where pressure injuries develop, and sacrum is number 1. So it's very important to pay particular attention to the residents' feet. Inspect their feet in the morning when putting their clothes on and their compression hose or stockings, and at night when you're taking their clothes off or their stockings off for the evening. Pay particular attention to the heels and toes and ankle area. Apply Alavista number 2 or number 3 lotion to the feet in the morning and at night, but avoid putting the lotion in between their toes. Nail care should be done weekly on their bath day unless they are diabetic. The nurse will do that. All footwear should fit properly. If they leave marks on their skin when you are putting their shoes on or off, make sure you let the nurses know as soon as possible so they can assess the area. Also, if you notice the resident's family brought in new shoes, please report that to the nurses as well so they can keep an eye on their feet for the first week when they get their new shoes. Chair guidelines. Every resident in our facility either has a pressure reducing or pressure relieving cushion to their wheelchair. Make sure the cushion is in the right way. Also make sure the cushion has a protective cover. If it becomes soiled and it was sent to laundry, make sure you get a new one from your restorative aid on your neighborhood or from the therapy department. Reposition the resident every 2 hours and as needed. Again, trying to provide comfort for the resident and reduce pressure to their skin. If a resident can, they should shift their weight every 15 minutes or so. If lifting up in the chair, the pressure should be relieved for about 10 to 30 seconds. If they're able to stand them up for at least 30 seconds and then sit them back down. Report any sliding forward or any leaning or slouching in their chair to your nurse. Bed guidelines. Our standard mattresses are all pressure redistributing mattresses. We also have air mattresses available for those residents that are higher risk or have pressure injuries or other skin issues. Make sure they are plugged in and working every shift. Do not adjust the control settings as they are specific to each resident. Reposition and turn every resident at a minimum 2 to 3 hours and as needed. Use pillows between their legs, ankles when they are lying on their side to prevent pressure points. Make sure if they have heel protectors, whether they are Preblon boots, blue boots, Rook boots, or heel bows, that they are on. Document refusals and inform your charge nurse. Avoid positioning residents on an area of redness or pressure injury when they are in bed. You can reduce mechanical injury of the skin by using assisted devices such as draw sheets or swift sheets, lowering the head of the bed, and lifting during transfers or boosting. Make sure that the clothing and linens are not bunched up and wrinkled as well. Nutrition. Encourage fluid intake with each encounter with your residents. Make sure residents get their supplements and or snacks as ordered. Report weight loss to your charge nurse. Standard is to report any weight gain or loss of 3 pounds to the dietitians. Encourage residents to eat and assist them if necessary. All residents at skin risk should be encouraged to eat a well-balanced diet. Document your skin observations in POC. This information also transfers to the dashboard for the licensed nurses. Be sure also, though, however, to report when you find skin issues at the time of finding and also at the end of shift and report. These are your choices under skin observation and POC. Scratched, red area, discoloration, skin tear, open area, none of the above, resident not available, resident refused, or not applicable. Make sure, however, that you also report your findings to a nurse immediately when upon finding any skin abnormality, and also again at the end of your shift when you're doing end of shift report with your charge nurse. In POC, it will also ask you if this is a new skin condition. Either mark yes or no. It is essential that you observe all resident skin with morning and evening cares, with toileting or with incontinence care, during bathing and showering. Report to the charge nurse any changes you notice with the resident's skin status. You are essential in observing and reporting any and all skin concerns. Early detection is key for prevention of skin injuries. Also, you are very essential in carrying out the resident's plan of care for skin prevention by making sure their individualized interventions for skin prevention and/or treatment of their pressure injuries are carried through. You all make a difference. If we all work together and provide the care guidelines provided in this webinar, we can decrease our incidence of pressure injuries for our facility and improve the quality of life and quality of care for all of our residents. Thank you again for participating in today's webinar.